I've entered my patient's room. I'm going to always do hand hygiene first and put on my regular gloves. I'm going to assess Mrs. Johnson for falls risk and implement interventions to prevent falls in the hospital. So we're going to use a bedside tool called Morse Fall Scale. And I can talk to the patient and ask them, do you have any history of falling? She has fallen recently, so that gives her a score. So each category gives the patient a certain score. Secondary diagnosis, if she has any other besides her primary diagnosis, she has more than one, so we would give her a score for that. If she has any ambulatory aids, if she leans on furniture, if she uses crutches or cane, if she uses a walker, or if she's on bed rest, each of those questions or each of those identities there would require a certain score. If she has an IV or not, that will give her a score. Her gait, if it's impaired or weak, or if it's normal or bed rest, she'll get a certain score. And then mental status, if she forgets things, gets confused, or if she is oriented, she will get a score for those. What I'm doing for her is her score is considered a high risk. And so each of these will allow us to do certain interventions to prevent her from having a fall in the hospital. So for the high risk, I'm going to do a couple of things. These are some pretty primary. I'm going to put a sign on her door. It says, please call, don't fall. Put a sign on her door. Probably put a sign maybe by her bedside table. I'm going to put an armband on her that's yellow. Kind of think of a caution. Put it on the same side as her ID band. And that also reminds her not to get up. And there are other things that we can use too, such as bed alarms or family or sitters, if we think that she might get up without asking. Then I'm going to go ahead and put some footies on this patient. These have no skid bottoms. And all of these things I'm doing are interventions to prevent her from having a fall. So besides putting the socks, the sign on the door, the armband around her, I'm going to also keep the bed low and locked. I'm going to do frequent rounding hourly to assess her needs. If she needs any help going to the bathroom, if she needs anything to drink or eat or reach her personal belongings, or if she has any pain or needs to be repositioned, because those are all things that people tend not to call out on the call light for, and then they end up having an accident and falling. So her bed looks okay. I can raise it a little bit more. And those are interventions to prevent her from falling.